Member for Tantramar.
Merci, Madame la Présidente. I also want to rise to speak to this issue of public health and the Chief Medical Officer of Health because I think it is one of the most important issues that we could tackle as a province. We, as New Brunswickers, our population could be a whole lot healthier. We have very high rates of chronic disease, in many cases multiple chronic diseases. I know my riding is one where there's a large percentage of people that have multiple chronic diseases that need to be managed. We, I would say, have so much potential for what could be done to address population health, for what could be done with public health, and we are nowhere meeting that potential. We are not meeting the goals that we should be meeting to make sure that all babies have a good start, all children have access to the resources they need to be healthy, as well as their parents, making sure families are okay. And I think the leader of the third party spoke very well to a lot of these issues, but I wanted to also add my voice to this. I do agree with him that this is a missed opportunity to really ensure more independence for the Chief Medical Officer of Health. I'm not convinced that what is in this legislation goes far enough by a long shot. Having cabinet and not just the Minister of Health hiring and firing the Chief Medical Officer of Health, I don't think goes far enough. I don't know that it will make that much of a difference. Ensuring that the Chief Medical Officer of Health's mandate and office is rebuilt after having been torn apart under the Gallant government, having been spread out throughout the civil service, as the leader of the third party detailed, that is what needs to be done. There need to be appropriate resources, including medical experts, including policy officials, including communications staff, to make sure that the Chief Medical Officer of Health can do their job, to be communicating with the public, and for them to be able to be effective in the work that needs to be done. When this office was torn apart and kind of pieces of it sort of thrown around to different parts of government, it's ended up that there were experts that were sent to environment. There are folks in justice and public safety. There are people in health. The RHAs then have a role in public health as well, and it's quite it's quite all over the place. And I think that it means what we don't have is a very strong mandate and then the resources to back that up for this office. And there are a few places where I think that a huge difference could be made. I think of perinatal health. I think of the lack of adequate health care for people who are pregnant, when they're pregnant, postpartum, and their babies, not necessarily having a visit from a public health nurse. Most of us not having access to midwifery care, which is something that needs to be fixed. There are so many opportunities for earlier interventions and for prevention that would save us money, but more importantly, provide better health outcomes for New Brunswickers, Madam Speaker. And that is not happening but that is what should be happening. And so I am disappointed with the lack of independence, the lack of resources, and the lack of a mandate really given to public health to make sure that we have what we needed. We're not even keeping up with immunizations for kids, Madam Speaker. It's hard to get immunizations in my community, Madam Speaker, for kids especially. So even the basic functions are not being met, let alone ensuring that the determinants of health are being addressed, including addressing the harms of alcohol, as the leader of the third party mentioned, including addressing I guess there's so many pieces of health that need to be addressed, everything from stress and physical activity and diet. And I would love to see a lot of leadership from the Chief Medical Officer of Health, and I would love to see government really understand the holistic nature of health, and that it isn't just the health department that's going to need to do something. We need to understand that addressing poverty, addressing work conditions, addressing food security, addressing all of these things, addressing online harms of social media, for example, to youth. There are a lot of things that need to be addressed in order to protect our youth, in order to protect the health of New Brunswickers. So there's a long way to go. I'm not confident that this legislation takes us very far in terms of the independence and in terms of what needs to be behind the Chief Medical Officer of Health in order for them to really do their job and serve New Brunswickers in the way that they deserve. And so thank you for the opportunity, Madam Speaker, to rise to speak to this legislation.